Hi, everyone. Thank you for joining us for this very special presentation. Our presentation today is for the Quality Payment Program, so QPP SIRS, for those small, underserved, rural uh, practices. This is our QPP SIRS series, and this is our second video. This video is going to be covering the MIPS Quality Performance category. My name is Brent Doom, and I am accompanied by my colleague Vance Drakeford, and we are both quality improvement advisors here at the Kentucky Regional Extension Center. Before I get started, I just want to zoom through our disclosure here at the bottom, just letting you know that our information in today's presentation is for general information purposes only. While we try to keep it all up to date, we do understand that things can change very rapidly in healthcare, as we've learned within the last year. So we make no representations or warranties of any kind in respect to the content in today's video. Before we get too far into the presentation, I just want to let you all know that we at the REC strive to be your trusted advisor and partner to healthcare organizations to supply that expert guidance to maximize quality, outcomes, and financial performance. We work with a ton of practices across the state and have historically. We have services ranging from physicians to hospitals, both covering promoting interoperability, formerly known as that meaningful use, HIPAA SRA, project management and vulnerability scanning. We have consulting for PCMH, PCSP. We also look at value-based payment and QPP support, as well as quality improvement for both physicians and hospitals, and then telehealth services, because telehealth has really hit the ground running this last year. And so the first question many of you are asking, I'm sure, is what is the quality performance category? The quality performance category measures your performance on clinical practices and patient outcomes. So those actual quality measures are tools that help us assess healthcare processes, outcomes, and patient experiences to ensure that they align with driving quality improvement and achieving those goals for healthcare. And now, as basics for quality reporting, you're going to submit a required 6 measures. Unless you're using the submission method CMS web interface, in which you would submit for all of those required measures, you're going to be required to submit at least six measures for the quality category. At least one of those 6 has to be an outcome measure, so looking at patient outcomes. And then there are 2 population health-based claims measures that you will be assessed on for quality. And so now I'm going to be turning it over to my colleague Vance Drakeford, and he's going to walk us through the 4 steps of quality.
Great. Thanks, Brent. Welcome, everyone. Yes, let's talk about some basic 4 steps of your quality performance category. What do you need to do? So we're trying to make this easy. And first of all, you just want to understand what your reporting requirements are. And then you want to choose those 6 measures that Brent was speaking of and really understand what's involved with each of those measures. And then you're going to collect that data for that year and then submit data once that year ends and you have that open time frame from that January 4th through March 31st of 2022 is when you're going to submit your data. So let's go into step 1 a little bit further. Understanding your reporting requirements. So the quality performance category, it has a 12-month performance period. So that runs from January 1st through December 31st of 2021. So we've already begun for this year. Now, this just means that you've got to collect data for each measure for the full calendar year. Now, to meet the quality performance category requirements, you're going to have to report a couple of different, or one of these 3 ways. So choose 6 quality measures. That includes that 1 outcome or high priority measure that Brent talked about. Or you can use a defined specialty measure set or subspecialty measure set. You can choose one of those. Now, if one of those measure sets has less than 6 measures, you just need to make sure you submit all measures within that set. And that would still qualify. You don't need to find an additional measures to make 6 measures in that case. And then, or you can choose If you're choosing that CMS web interface for large organizations, then you can choose that, and you will have to use all of the measures that are incorporated within the CMS web interface option. Now, as you choose your quality measures for step 2, you've got over 200 measures that you can choose from for the 2021 performance period. Now, these measures are available through the different collection types that are out there. Some of them require you to work with a third party, such as a qualified registry, to collect and submit your data. And then other collection types allow for you to report the measures yourself. So we kind of wanted to take an example and look at that. And we've used the most widely used collection type out there, and that's ECQMs, or the Electronic Clinical Quality Measures, which is your EHR. So most people use their EHR data and report to submit that collection type. Now, if you use this type, what you do need to remember about this is you have to have a 2015 certified edition EHR, and make sure that those measures that you're choosing are supported by that certified electronic health record technology. Also, some people have multiple EHR systems within their organization. So if that's your case, or maybe you transition from one EHR system to another during the performance year, you're going to need to aggregate that data from your previous EHR into that new EHR into one report, or combine data from multiple EHRs into one report for that full 12 months prior to submitting that data. Now, if that full 12 months of data is unavailable, so if aggregation isn't possible, your data completeness has to reflect the 12-month period. So, and just keep in mind, it has to be that 2015 certified edition. Now, this is available if you submit for individuals, or as a group, or as a virtual group. Now, as you're choosing these measures, we've talked about, who can submit that for you. That can be yourself, or maybe you're going to choose a vendor, the third-party intermediary, to do that for you, or that CMS survey vendor might submit a measure for you. So there's different collection types. The ECQMs, we just went over that as an example. There's also the CMS web interface, Medicare Part B claims, MIPS CQMs, you can see there in the QCDR measures, are under your registries. So that's what that is. How you submit the measures are listed beside of those of how you submit that. Most all people use the QPP portal. There's that website, the qpp.cms.gov link, and that's where you upload your files or submit your data through that for quality. And they do have to have a specific format type that's, as you can see there, it's a QRDA3 or a JSON file. That's the format type that you'll have to submit data within that portal. Now, when do you submit that? Of course, in that open period from that January 4th through March 31st. This was a screenshot from CMS, and they have not updated for the next year, but all the information is still the same. So the date says 21, which in essence, it'll actually be 22. Now, once you've decided which measures you're going to choose, you're going to need to know what does each individual measure mean and what you need to collect for that and what patients fall into those different measures. So you're going to have to look at your measure specification sheet from CMS. These spec sheets are going to give you all the details that you need to know, what you're collecting on data for that specific measure, what patients fall into that, which qualify for that, should qualify for that measure, and what constitutes you getting credit for that measure. So it's very important that you read these spec sheets once you choose your measures, or even use them as you're choosing your measures. you can see here what's included. The collection type, you also need to know the measure type. This specific measure is the A1C poor control. So you can see the collection type. It's a CQM, MIPS clinical quality measure. So this is one of those the registry submission type measure spec sheet. And then you're going to look at the description of what's included for this measure, and then what constitutes that numerator and denominator information. And then it's going on to give you different details regarding rationale and the clinical recommendation statements. So it's very, as you can see, this one has 11 pages. We're just showing you that first page there to give you the basis to the spec sheet. So these are really important that you follow these and you understand these. So now as we move on to step 3, you're going to collect your data. So again, you're going to start January 1st of that performance period, which for this year, that was in 2021, we're already into that. And then you're going to make sure that you have to have at least 70% for your data completeness. And that just means that you need to report performance or your exclusion exception data for at least 70% of the patients that are eligible for that measure's denominator. Okay, so if you have 100 patients that are eligible for that A1C poor control, you're going to need to have at least 70% or 70 of those patients or more included to meet that data completeness requirement. And then you're going to have to work with your vendor or your third-party intermediary to collect and submit your data. So if your EHR vendor is going to submit the quality data for you, you're going to have to work with them or your registry, etc. So as you start to submit your data, you're going to have to know if you're submitting as an individual for each individual clinician at your organization, or are you submitting as a group or a virtual group? Now, whichever you decide is fine, but you have to choose the same submission type for each category. So you can't choose individual for quality and then maybe for another performance category, choose group. They all have to be the same across all performance categories. They cannot combine data submitted for that into a single final score. So just keep that in mind. So data submission types, well, there's different ways that you can submit it for the different categories. And you can see here the 4 performance categories on your left. The quality is what we are speaking of today. So for that, you can do that direct, straight from your QCDR, your registry, qualified registry is going to do that directly for you. Most people use the login and upload submission type. And that's where you go into the portal and you sign in, and then you upload your QRDA3 or JSON quality file and submit that way. And you can see here for quality, you can submit that as an individual group or through a third party can do that. And then the collection types, you can see all that's listed for quality, what's available out there to submit the quality data. That wraps up the 4 basic steps here. I'm going to pass this back to Brent so he can go over the overview of the MIPS program here and finish us out.
Thank you so much, Vance. A lot of great information covered in your slides. Real quick, we want to show you an overview for the QPP year 5. So, of course, we're already a couple months into year 5, but just a brief overview of the timeline that the QPP final rule, that legislation process follows. So, of course, last year we had performance year 4, so 2020, where we had that plus or minus 9% at risk. And then for December 1st, 2020, this was when our final rule was released for year 5. So at the end of year 4 performance year. And so, like I mentioned, we're already a couple months into performance year 5, or known as year 2021. And again, we're seeing that plus or minus 9% risk. 2021 is the year in which we see the transitional phase ending and the QPP shift to traditional MIPS in year 2022 and beyond. So we're seeing some of those exceptional performer bonuses shift. We're seeing that minimum threshold shift, and then we're seeing some of those category weights shift. So for 2021, we're seeing 40% for quality weight and 20% for cost. And then for 2022 and beyond, we're seeing them shifting 10% from quality over to cost to equal quality and cost at a equal 30% for each category. And so a few changes to quality. They added 2 new administrative claims measures for year 5, and then they removed 11 measures, including 1 being all-cause hospital readmission. As far as requirements and performance, data completeness is still at that 70%. We saw that shift just a year or 2 ago, where they increased it. So we're still at that 70%. So just be sure that your data completeness is up to at least 70%. You have your 365-day submission timeframe, as Vance mentioned, also requiring you to have a 2015 certified EHR, and then, of course, maintaining your historical benchmarking. They maintained that status, so we weren't having to create our own benchmarks. And then with the public health emergency that was COVID-19 that we're still seeing, of course, telehealth, a lot of parameters exploded with that. So they're being much more inclusive of telehealth. And as I mentioned here on the right side of the slide, we're seeing that 40% for 2021 and that 30% for 2022 for category weight. Some opportunities for bonus points that fall under the quality category. We have our small practice bonus. This is where you have 6 points added to your numerator for your quality performance category, just simply for being a small practice. You don't have to do anything to get this other than be designated as a small practice. As Vance and I have both mentioned, for those high priority and outcome measures, you can submit more than just that 1 required to get bonus up to 10% of your numerator for quality. And then for improvement, you can again get up to that 10% bonus for improving year to year with your quality performance. And then for submitting quality measures for that full 365 days, getting that end-to-end bonus, you can earn additional points for each electronic submitted measure for your quality score. And just to highlight, so this is our second of 4 videos that we will be releasing during this QPP SIRS series here in early 2021 to help provide that foundational basics for the MIPS tracks of the quality payment program. So this past month, we had just a general overview of the MIPS track. This month, of course, is quality. We're going to take March off while all of you all are finalizing those attestations, finishing those up. And then in April, we're going to be doing MIPS promoting interoperability, and May we'll do MIPS improvement activities. And lastly, just to wrap up, I want to encourage you all, if you have any questions, would like to reach out to find out more information about our services with working with us, or if you simply want to connect with us on any of our social media, please feel free to reach out. We would love to hear from you. We would love to work with you. Feel free to contact us at our phone number, our website, or our email address, or any of our engagements on social media. We love to get information out to you all, so we would love to interact. Thank you so much for joining us for this special presentation.